Pathway of Blood in the Heart,
made by Paige Salvatore.
and Elizabeth Piacenti.
Pathway of deoxygenated blood.
The oxygenated blood enters through the superior and inferior vena cava into the right atrium, then through the tricuspid valve into the right ventricle and up the pulmonary valve and out through the pulmonary artery.
Pathway of oxygenated blood. Oxygenated blood goes in through the pulmonary veins, into the left atrium, through the bicuspid valve, into the left ventricle, up through the aortic valve, and through the aorta.
Parts of the heart. The heart contains the left atrium, left ventricle, right atrium, right ventricle, tricuspid valve, bicuspid valve,
Aortic valve, aorta, pulmonary valve, pulmonary artery.
Pop quiz! Which three parts of the heart are missing, which are labeled by the question marks?
If you guessed inferior vena cava, superior vena cava, and pulmonary vein, you would be correct.
How to find your resting heart rate.
To find your pulse, place your middle and index finger on your wrist below the base of your thumb. You can also find it putting your middle and index finger right under your jaw on your neck.
When you feel a pulse, use a clock or a timer and count the number of times your heart beats in 30 seconds.
Once 30 seconds is up, multiply the number of beats you counted by 2. A typical resting heart rate is between 60 to 100 beats per minute.
Testing blood pressure.
To test your blood pressure, you will need a blood pressure cuff. Place the cuff above your elbow and have your palm facing up.
Pump the cuff up to 200 and slightly turn the valve towards you to release the pressure. Once you see the arm of the cuff bump back and forth, note this is the first time it bumped. This is your systolic pressure. Your systolic pressure is the maximum blood pressure during contracting of the ventricles.
Note when the hand is no longer bumping back and forth. This will be your diastolic pressure. Your diastolic pressure is the pressure in the arteries when the heart relaxes between the beats.
It's time for another pop quiz.
Which side of the diagram shows the systolic pressure and which side shows the diastolic pressure?
If you guessed left diastolic and right systolic, you would be correct. Now it's time for the heart dissection. In class, we dissected a heart and identified its chambers.
Here's a video of the front of the heart and the back of the heart, as well as a top view.
Then we use flags to label parts. Each flag represents the 5 major blood vessels of the heart.
We threaded a blue string through the vena cava, down into the right atrium, through the tricuspid valve, into the right ventricle, up through the pulmonary valve, into the pulmonary artery. This represents the pathway of deoxygenated blood.
We then threaded a red string through the pulmonary vein, down the left atrium, through the bicuspid valve, into the left ventricle, up through the aortic valve, and out through the aorta. This is a view of both the deoxygenated and oxygenated pathways of blood, labeled by the red and the blue strings. This here is a top view. Atrial septum defect.
ASD, or atrial septum defect, is a small hole in the wall separating the left atrium and the right atrium. This defect is present at birth. ASD causes more blood to flow to the lungs, which can cause possible damage to the blood vessels of the lungs.
The mixture of oxygenated blood and deoxygenated blood increase the efficiency of oxygenated blood being carried throughout the body, causing the organs to not function properly in the heart to work overtime.
In some cases, atrial septum defect can go away on its own. In the case that doesn't happen, surgery will be required while the child is still young.
Bye!